Hey there. Update today comes from Missouri. I'm driving north. I stayed overnight at Cape Girardeau, right on the Mississippi. Many claims to fame, but the one that I immediately connected in my mind was Rush Limbaugh's hometown. I'm headed north towards St. Louis from there, and then on briefly to Macomb, Illinois, before I head back west again. And I stopped by actually Rush's boyhood home just as a point of interest, and I was thinking about how sometimes if you're so ideological, you can be blinded to practicalities, and I think I hear that as I listen to Rush these days. I'm okay with his thinking on, the economy needs to be opened up, but it would be really nice if he would mix that with a dose of everybody should be wearing masks, because unfortunately the message that I think most people end up getting from him is that, we have the freedom as Americans to do whatever we want, but, again, my freedoms should not be impinged upon by your freedoms, right? So if you being free to run around and party and be in close contact and contract the virus means that if and when I contract the virus, there isn't going to be an ICU bed available because they're all full up, so I'm not going to get top flight medical care, and I could have permanent damage or die, then I'm sorry, I don't agree with your freedoms in that case, which is why health departments exist in the first place. And then just on the mask issue, I was thinking about it, especially back when I was visiting Houston, all the time, constantly, as you're walking around MD Anderson Cancer Center there in Houston, there's people all over the place walking around with masks on that are patients, so they'll be in a wheelchair with a mask on for whatever reason, but normally it's clearly they're leukemia patients, and they're wearing the mask in order to protect them from infection. And then yet at the same time, I hear so many people talking about how, well, a mask won't keep you from being infected. Like, okay, yeah, the simple surgical mask is not perfect. Not at all perfect, right? Yeah, that's true. But it does something. It does provide a barrier. If it didn't provide a barrier, the leukemia patients wouldn't be wearing it, right? So, that's just a little diatribe on masks. The last thing I was going to talk about is there's another study that came out of China with some rhesus macaques, little monkeys, and they took 6 of these little rhesus macaques and purposely infected them with COVID-19. They use macaques because their physiology is so similar to humans, so they figured they'd get similar results. And of the 6 that they infected, all 6 of them did recover, but they kept track of what their, whether they had fever, what all their symptoms were and such. And then after 28 days, they reinfected them again. And it's it's not like the hamsters in masks study that I did the video on, but this one is, they essentially took a dose of virus and stuck it down their trachea and said, here you go. So it was like well input right into the bronchial area. And so what they ended up finding was that of the four of the 6 they reinfected, they saved the other 2 as controls, that 4 of the 6 that they reinfected did have symptoms again, but none of them had anything near the symptoms that they had seen previously. So it's a very small sample set on the study, but what it would seem to indicate from the study is that having had the virus, there is definitely some immune response that is acquired that is protective from reinfection. So assuming the virus doesn't mutate too quickly, then that should mean that those who are infected with the virus will not really be as challenged by a second reinfection. It appears that they can be reinfected, but the symptoms will not be as severe. So, as always, stay safe. Wash your hands with soap and water. Use hand sanitizer with at least 60% alcohol if you don't have access to soap and water, but soap and water is better. And wear a mask to protect others and to protect yourself. Wear a mask when you're in public. And together we can reduce the spread and get through this. Thanks.